All right. Nicole, let me know when the attendee trickling in has stopped, and I will kick things off.
It's slowing down, but we got some people joining. Give it a couple, maybe.
Sure.
All right, you could probably go for it.
Okay, fantastic. All right. Hi, good afternoon, everyone, and welcome to someone's mic is on. Um, Cliff, I think you're good. Okay, here we go. I was just hearing a little bit of echo, so just wanted to make sure. So false start, 5-yard penalty. Now we're good to go. Good afternoon. Welcome to the 2025 webinar series here for the New York Association on Independent Living, or NIAL, NYAIL. I am Blaise Bryant, the communications specialist here for the association. I am sitting here at my table here and wearing a sweater. I'm a man in my mid-30s with a little bit of a beard going on and some black hair here. Quick logistical things here before we get into the panel. Number one is that the webinar is being recorded, and the webinar will be made available tomorrow. Number two is that the chat is disabled for attendees, and this is for a screen reader accessibility accommodation. And number three is when I send out the recording, I will also email a quick feedback survey. It's 5 questions. It takes very little time. It helps me plan the webinar series. Victor, easy, buddy. We've got, dogs here too. So that's really it for the logistical stuff here. So joining me for this panel, which I will be moderating on Paratransit, and I'm going to do this individually here, so everyone who can get a sense of people's voices. Oh, Evan is back. Okay. Cliff, I'm just going to have you unmute quickly and introduce yourself. Cliff is the systems advocate with the Independent Living Center of the Hudson Valley. Thank you so much, Cliff. I am not hearing you. I'm hearing you here in the.
Cliff,
I'm
you're
not
on
hearing.
mute.
Oh, I will. Oh, it's actually muted on the computer, but I'll come around and help you with that. We're sitting here in the same space, dealing with a little bit of a tech issue, but I'll when I'm teeing off the first question here, then I'll come and help you out with that. Sorry. So, well, Todd Vaarwerk, you are unmuted, and Todd is the policy analyst with the Western New York Independent Living. Thank you so much, Todd, for being here.
Well, it's nice to be here, and it's nice to see all the participants that want to hear about paratransit today. For those people that are interested to know, I'm a white guy in my late 50s with a beard, glasses, and a headset with a microphone.
All right. Thank you very much. Evan Yankey is with us. He is the advocacy director with Brooklyn Center for Independence of the Disabled. Evan, thank you so much for being here.
Yeah, thanks for having us. Also, Blaise, I just wanted to let you know I've been talking to someone who's talking to Stephanie Speaker, who should be joining by phone.
Okay.
I'm here.
Oh, Stephanie, you're here?
Yep.
Okay, fantastic. You have won the battle of the power outage. Fantastic. And Stephanie Speaker is here with us. She is a self-advocate and paratransit advocate. Thank you so much, Stephanie, for being here.
You're welcome.
Really appreciate it. So I'm going to kick off the first question, and Stephanie, if you're okay with it, I'm going to tee you up first. So talk about the current state of paratransit in New York. Just give us a couple of minute basic overview on where things are right now.
Well, right now the senator gave me a call yesterday, and he reintroduced the new bill.
Stephanie, I'm just going to chime in for a sec. You know, because this is a webinar, it'd be helpful if you could just, when you're talking about people, just sort of mention who they are. I know you're talking about Senator Jeremy Cooney, who's the transportation chair, but I'll let you go on.
Senator Jeremy Cooney is the transportation guy that took over for Congressman Kennedy when he was a senator. Cooney called me yesterday and he told me that he reintroduced the bill, and now I'm waiting for a phone call back from him to give me the new bill number. And he's also said that he's going to be pushing that bill. He's going to be finding out how much the governor has in her budget for transportation. And
Stephanie, can you tell the audience how you got into this gig in the first place?
Right. Yeah.
Paratransit it was only going 3/4 of a mile from a big bus stop. And two people, my friend BJ Stachio almost froze to death at Mickey Kearns' old assembly office. And they cut the service also for paratransit. It would only go to the Southgate Plaza. So I looked up and I seen the assembly guy's office. I went in. I asked them if there's an assemblyman. They said yes. They said, would you want to see him? I said yes. So me and Mickey, we met 11 years ago. And I asked, he came out, he goes, what can I help you with? And I said, well, first of all, I got to find out how we can get from point A to point B. He told me that his staff could take me. So he asked me what else he could help me with. And I told him, I said, I need help getting better transportation for me, my friends, the veterans, and the seniors. He asked me how I would like to get a bill started. We got started that day. And now the bill is coming out of the Senate, and he's going to push it out for paratransit and see how much money the governor's asking for transportation.
Gotcha. And just so everyone knows, and I should have said this in the intro, Stephanie is Buffalo based, much like Todd is from Western New York Independent Living. Todd, do you want to piggyback off of anything Stephanie just said?
To answer the question that just popped in the Q&A, the reason why we're talking locally is that the Public Transit Authority cut off access to a state office that deliberately assists people with disabilities. OPW, you can say a lot of things, but New York State OPWDD, but one of the things you can definitively say is that their very charge is to serve a population of significantly disabled people. So their issue primarily was that the NFTA cut off public transit service to the very office that was serving people with developmental disabilities. And that's how the upstate movement on paratransit expansion started. Now, Stephanie, talks about it from her local experience because that's what she does. But we also know that the bill that she's talking about is a conglomeration of the stuff we talked about in upstate and work done in downstate to bring the divergent perspectives together.
And the new bill number in the assembly is A574 is in the assembly.
A0574. Thanks, Stephanie.
Right. And because Cliff, I know you were really involved in this legislation, and we'll have people hear from you now that we've taken care of the tech issues. Give us a high level explanation as to what this bill that we've been talking about for expanding paratransit will actually do.
It will.
Well, for me, I mean, to tell you the truth, the one who could really answer this question is Todd. Todd's really good at this. But my idea was, I've been working with transportation for a very long time, and paratransit is one of those services that had worked on over the years in various ways to from curve, from door to door, when it used to be it didn't used to be from door to door. That's one of the changes that we made. But in any event, we're looking to expand, obviously, as it was already been stated, paratransit from the distance that is presently, which is only 3/4 of a mile, from, let's say, from either side of where fixed route goes. So if fixed route is in a certain place and it ends, then from there, paratransit can go 3/4 of a mile beyond that, which we thought that's insufficient. And as you heard, Todd, at least from the DD side, how that was sort of triggered for them to take notice that, this is something that we need to look at and address. And in doing so, we, many of us, as Stephanie mentioned, her working on her side, we meaning the independent living centers through NILE, and our transportation committee worked on getting the assembly to put in a bill as well. I pushed the bill to be about 5 miles on either side because I figured we needed something to negotiate with. If we just went with what we wanted, then that's not what we would get. It seems as if, I like to think that worked out. I knew that the 5 mile was too much, but as I said, we needed that to work down to about the 3 miles. And I believe, and Todd can correct me on this, but I believe that's what we got it down to. And he can explain this further about the 3 miles on either side, or 6 miles, meaning on each side. All right. So 3 miles on one side and 3 miles on the other side, giving you a total of 6. Right, Todd?
Yep.
So that's what we put. That's what I was getting at. That's what I really pushed for in terms of making it longer so that we could at least get this much. And it looks like that's what we've got. So,
well, and remember that the process originally was meant to change state law to reset the minimum area for paratransit, because that 3/4 of a mile, whether your local location uses it or not, because I see Marilyn's comment, is federally based. It's in federal law that it's 3/4 of a mile on either side of a bus route. And we know how difficult it is to open up the ADA to national discussion to expand anything, because if we do that, then people are going to want to open up the ADA to other challenges that will restrict things more. So,
but
advocates,
Todd, as you and I know, and they probably need to know, that although that is what's in federal law, that is stated as like the bottom.
Yes.
It does not negate
it is the
fact.
floor, not
Thank you.
not the ceiling, right?
And they can do more if they made it very clear that each locality could do more if they wanted to. They just choose not to. I just want to make that clear.
And the vast majority of communities in New York, especially their public transit authorities, stick to that 3/4 of a mile like it is a ceiling when it's actually a floor, right? So in our advocacy to change the state rule, because the federal law says if the state provides stronger protections, then the ADA will enforce those protections, right? We advocated for expansion, and the best they could do immediately was allow us to study it. So they put together a bill to give the Niagara Frontier Transportation Authority $750,000 to commission a study on how much it would cost to expand paratransit in both of those buffers that Cliff talked about. the 3 mile buffer, a mile and a half on either side, and the 6 mile buffer, 3 miles on each side. Right? It took a while for the study to finish. And when we get to that portion, when Blaze will ask me, I'll give you what the numbers are.
Todd, you set me up perfectly. Now let's head down to Brooklyn, where you are, Evan, and talk about how New York City handles paratransit and how things look down there.
Yeah, sure. And I saw a question in the chat about New York City because New York City paratransit covers all 5 boroughs. So why would a New York City organization be supporting this paratransit bill? Well, it's good for the rest of the state, but I also want to put this in perspective. So when we're talking about this range, if you imagine for wherever you are, the bus route for your city or your county or your area, and then imagine a little 3/4 of a mile buffer on each side. So, and you can actually look up these maps to see the range. So maybe in the city or county where you live, the bus routes are pretty good. And they get you to places you need to go, from places where people live to hospitals, grocery stores, libraries, employment sites. And maybe they don't. But if you imagine the map of the bus routes in that area and then a 3/4 of a mile buffer on each side, it's a very thin part of that area that people with disabilities can get to. Um, when we talk to people in these different areas, when we did a transportation forum in Rochester, or when we talk to people in Syracuse, everyone has a story of a place that they can't get. So sometimes those places are medical sites where you need to go for medical appointments. Some of them are places where you might have a job. Talking to Syracuse, we were talking about the new Micron plant, which is going to be a big employer. All this money that the state is investing into these employment sites, and people with disabilities are not going to be able to get to it. So the expansion really impacts all of us because it impacts how New York State spends its money, how New York State plans its housing, how people can live in their own communities. For New York City, we have a lot of problems with the quality of paratransit service, which I'm happy to talk about. But I do want to push back on the idea that this is not an issue for New York City, because it is. New York City has a lot of people who travel from surrounding regions, whether it's Westchester or Nassau or Suffolk counties or Rockland counties, Orange County, Sullivan County, even. People are living farther and farther out. And sometimes you can make transitions between those county level paratransit services to New York City, and in some cases you can't. We get a lot of calls from folks who are not able to make the transition from New Jersey paratransit to New York City paratransit because there's a disagreement about where the transfer point should be. Should the transfer point be in the middle of the Hudson River? It's disagreements like this that impact us, but it also impacts, for New York City, questions about where should the city and the state and other entities spend money for housing for big employers. People with disabilities deserve to be part of public life. And that means removing limits on where people can travel, where they're able to travel easily. And for New York City specifically, having that expansion, having that ability to be part of your whole locality, the whole area served, serving everyone else, it's going to impact New York City as well. So we're really all in on this fight on paratransit expansion. I'm happy to talk more about the specifics of some of our issues in New York City, because I know there's some folks in New York City on the call, but we're putting all of our energy into supporting this bill as much as possible.
If I may quickly, this is Cliff. I just want you to also know that I also looked into addressing the issue of crossing county lines, because I know that that's an issue that affects other people in other parts of the states. I just want to, I never forgot that. It was suggested that we address that later or find another way to address it, that somehow we couldn't really address that in this particular bill. I just wanted you to know that.
Yeah,
Guys,
I'm sure we could talk all day about the transfer issues and regulations. It's a big
I'm
issue.
following the Q&A, and I want to bring some things out to answer some questions for folks, right? And this starts with actually something that happened in practice because Cliff kind of as a joke asked if we do anything about what paratransit was. So I think it's really important because some of the questions are like, does this pertain to me? So paratransit pertains to you if, as a result of your disability, it is really hard for you to use fixed route service where you live. If you can't get to a bus stop, if you're having trouble navigating, getting on the bus and paying the fare and figuring out where you're going, if you have trouble getting safely to your spot when you get off the bus stop, you are, chances are, you are eligible for paratransit where you live. Now, paratransit as a federal construct is required by public transit authorities or people that provide fixed route transit in your community, right? So, unfortunately, the big thing with this is that in New York, most public transit isn't done. Rural areas don't have a company that provides transit. Maybe they're using rural transportation service, or maybe they're not. But all of this is for people with disabilities because even if you live in a rural area and you're going to an urban one, when you're in that urban area, you could be entitled to that transportation, right? And this isn't about a specific disability because I see a question about, does this relate to traumatic brain injury clients? If your disability perfects your ability to use the bus, this is an important discussion for you. Remember that transportation is the number 2 barrier to people with disabilities living successful in the community, right after affordable and integrated housing. My apologies, guys. I just wanted to
No, Todd, just to add to that, what
get
you've been
these comments
saying,
out. Yeah.
this orientation is something that you need to think about as well because that applies. It applies to people with maybe a learning disability, maybe a brain injury, other disabilities. It includes blindness. When we go to a new place that we don't know where it is, we've never had mobility instructions on how to get there, then paratransit applies to us for that as well.
Now, the one other comment I wanted to make, because like I said, I'm following along with what the participants are talking about. We're doing this on a state level with a state bill because even though we know that the regulations for paratransit were written in the 90s or the late 80s, actually, right, Cliff? They were written in the late 80s and it's been a while. The problem is if you open up a bill like the ADA to modification by the federal government, you're going to get unintended consequences with losing things that you're currently relying on right now. It's a lot easier for us to do this on a state level and set a higher state standard than it is to advocate nationally to attempt to improve paratransit with the ADA. To give people an example, every time they discuss modifying the ADA, they want to throw in something called the ADA Notification Act, right? Which would totally decimate our ability to demand accessibility in public spaces. So I wouldn't want to create that opportunity just to improve paratransit regulations when I can do that with a state bill closer to home.
All right, I'm just gonna hop in here for a quick second here, just to address one logistical thing. The reason why you can't see, for attendees cannot see questions and stuff in the Q&A is because it's set up, this is set up as a webinar, and because of that, only panelists can see the Q&A. And Todd, I am so grateful that you've been tracking the Q&A, and it's been a huge help for me as I'm trying to audibly read through things as well. One of the questions that did pop into the Q&A, and I want to get everyone's thoughts on this here for a couple of minutes. There's a suggestion that, or a question of, why are we not pushing for bigger reforms such as same-day paratransit here in this bill? And I don't know who wants to. You know what? We're gonna just round robin this based on alphabetical order here. So with that, Cliff, I'm gonna start with you, and then we'll whip around to Evan, Stephanie, and Todd.
I'm back.
God, here I thought it was going to be age, and I would still be first or last, so it didn't work out either way.
He
Um,
was using first name. I had a problem with my alphabet for a second.
Um, well, I mean, first and foremost, you see how difficult it is just to get this, okay? Just to start off. Legislation is very difficult. Um, and in my opinion, as somebody who's been doing this 40 years, the larger your bite, right? So think of it this way: the larger the bite, the harder it is to chew, the more difficult it is to swallow, and you could possibly choke on it. I'm just trying to give you an analogy that I believe applies to legislation. You make things too big, you really can muddle things up. It's really better to start with something smaller, get it refined as much as possible, work with that. You can always then, and if you succeed with that, the thing that's wonderful about legislation, or if you want to call it wonderful, is that when you have at least a minor success, it helps to get other successes. If you have a failure, ooh, not good. So it helps to do something small. And really, it's not, you know, it'd be great to have. I mean, I would like to see all different kinds of things. I've talked about what I call transition disabilities, things like lupus and MS or chronic pain that you don't know 24 hours in advance whether or not you're going to need paratransit. You could wake up that morning and go, "Oh my God, the only way I can get to work is using paratransit." But you know what? Because the way it's written, you can't do that because you need to provide 24 hours. So yeah, there are a lot of issues. We just thought that this is an issue. We can get this passed. We can then concentrate on others.
Well, I
Yeah,
thank you for your help.
All right, and then Evan, we're gonna circle to you, and then to Stephanie, then Todd.
yeah, I'll say a few things on this. One of the big problems with paratransit advocacy is that um, it's controlled by all of these local authorities. So the way that paratransit operates is linked to whatever locality you have. So there's not like a state agency of paratransit, and that's been tough for our advocacy. And it's why, as Cliff describes, we sort of have to fight things piece by piece. Part of our advocacy on paratransit is always linking the state level advocacy to local advocacy as well, because getting buy-in from those localities, one of the barriers I think on this expansion bill is that some local authorities might say, well, how are we going to pay for it? Well, the New York Association on Independent Living has also sent a letter asking for money to pay for paratransit expansions, but it really has to be done on the local level to each authority. So we're trying to overcome those barriers, but that is the barrier. I will also say, just to address some of the things that people brought up in terms of what we should be arguing for, there are examples of some innovations in paratransit that we do want to highlight around the state and that we want to push to expand. So in New York City, there's an on-demand paratransit pilot. Some people call it e-hail, but it allows people who qualified for paratransit and who also signed up for the pilot program to receive on-demand uh, rides in wheelchair accessible vehicles from for hire vehicle companies. So by for hire vehicles, we mean things like Uber and Lyft, vehicles that you would just hire for you. In New York City, there are wheelchair accessible for hire vehicle companies. If you were getting a ride through Uber or Lyft, you could request a wheelchair accessible
Oh, gee.
vehicle. The paratransit on demand pilot in New York City allows you to access those vehicles without paying the market rates because you qualify for paratransit, because you're eligible for paratransit, and because you would be paying a much smaller fee to ride paratransit. You are also paying a much smaller fee for that on-demand paratransit, which you can schedule just like anyone would schedule an Uber or Lyft whenever you want to. Now, obviously, this has all sorts of benefits for people. The biggest one is, you can choose when you go places, if your plans change, if other forms of transit aren't working, if there's an emergency, you can just get a ride. And one of the reasons that the MTA, which controls transit in New York City, went for this is because traditional paratransit vehicles are expensive. And so if they can do a compromise where they pay these for-hire vehicles to transport people with disabilities, it's actually not that much more expensive than a traditional paratransit ride. So it's a win-win for everyone. You know, our barrier right now is there's a limit on the program, so only a small amount of people can use it. So that's our big fight, is to expand the paratransit on demand program. There are other examples of paratransit on demand in other parts of New York. You know, in Albany, CDTA has the on-demand Flex bus, which is a bus that is wheelchair accessible that has fixed point drop-offs that you can schedule rides on. I was just talking to someone who's an advocate with Centro in central New York, and apparently there's an on-demand accessible program in Rome, New York, that they're experimenting with. So we do definitely want to promote those things because people deserve to have more control over when they make their rides, when they use their transit. But it is going to have to be a fight that's really both local and statewide and federal, but balancing all those pieces.
For sure. Thank you, Evan. Stephanie, over to you. Kind of that same question earlier of why this is for you personally, why this is so important.
Because expansion is important because people right now are getting stranded in their homes. They're also getting stranded in the cold, and I can't have that no more. People have to get around to work and to their activities right now, to different things that they have to get to, their doctor's appointments, like you said, and to work. So expansion is important right now to get that bill passed.
Right. Now, if I remember correctly, Stephanie, you predominantly rely on paratransit to get from point A to point B, right?
Right.
Okay. Do you have any stories that you feel comfortable sharing, of recent stories where you have been stranded?
I was stranded.
Yeah, go ahead.
Last week, Thursday, Todd, if you remember, we were at that meeting last Thursday. I got stranded at the bus station downtown.
In Buffalo?
In Buffalo. And all the workers and everybody, they left, except for a manager that I hope he gets recognition because he stayed the whole entire time that I was at the bus station, plus a receptionist that was at she stayed until I got picked up. I never got picked up until 5 o'clock last week, Thursday, and I never got home until 7 o'clock last week, Thursday.
So
how long were you waiting?
I was waiting for. They were supposed to pick me up between 3:30 and 4 o'clock, and they never came until 5. Then the bus driver, she said that she had to go to the city, plus she had to go all the way to West Seneca before she dropped me off. She also told me that she was supposed to be off at 5 o'clock. And
wow.
I don't think she got to leave until I got home. And that was she had to leave this garage if she got back at 7:30 because she dropped me off at 7.
So
right.
for the listeners to understand the context here, locally, the NFTA runs a meeting where they meet monthly with the disability community about the quality of services provided by the authority. Last week was the monthly version of that meeting where people with disabilities, including paratransit users, are in the building where the Public Transit Authority is. And you would think that knowing all of these people that are coming to this meeting and knowing approximately when the meeting begins and ends, that paratransit would be able to appropriately schedule that. but no, right? And she was left waiting almost 90 minutes outside of her window.
And do you know Andrew, Todd?
I do.
They sent a
He is actually one of our participants today.
well, they sent one bus out just for him and his companion. And when I went out there to see who the bus was for, they said they're only there for Andrew. Now, I think that was stupid that they sent one bus
Right.
out, took just two people on it, and then left. And then I had to sit there from the bus was supposed to pick me up at 3:30 to 4. I was there till 5 o'clock. The bus never came to pick me up, and I never got home until 7.
Right. Okay. We're starting to go around the circle here a little bit, Stephanie. Thank you very much. Now let's get to the. I know there's a question in the.
You actually wanted me to answer the question about expansion. I
Right.
don't want
Go
you to
ahead.
leave me off because my name is the last on the list.
You are correct, Todd. Yep.
So for me, my perspective on why we're not asking for more than just distance, and I've heard comments, you're absolutely right. We can ask for any kind of expansion we like. But a very wise former director of the New York State Independent Living Council once told me that there are only three ways to get really good policy done: money, votes, and media. And money is the thing that drives this particular question. Everything we ask for, they're gonna want to know how much it costs, right? And in order to be able to effectively advocate for what we want, we have to know the answer to that question. Which is why I know we're going to talk about the study in a minute, Blaze, but which is why it's important that we look at if we're asking for same day service, right? They're going to ask how much that costs. And I certainly know that Evan has those numbers when he's looking at how many people are using the service and how much it costs and what expansion would mean. It's the same thing with paratransit expansion. If you turn around and said we want to change the time limit that the ADA requires for transit, people are going to ask how much that costs. So it's important for us to kind of know those numbers. That was my comment. Now we're off.
All right, great. And it looks like Stephanie's connection dropped. Hopefully she's able to come back. There's a question in the chat, and then we'll get to the study. I promise you that. There was a question or a note in the chat about New York State human rights law being stronger than the ADA and a lawsuit in New York City. Evan, is this what do you know about this?
So this is not a lawsuit that we're part of, but I can explain the generalities of it. And it's related to something statewide as well. So New York City has a human rights law that offers protections for a lot of categories of identity, including disability. That's very strong. In this case, the lawsuit is about a lot of things, but quality of service and the ability of people to participate in public life. You know, we do have a lot of good things for paratransit in New York City, but there's also a lot of problems. The scheduling is the biggest one. It's a real impediment to people getting medical services, people having jobs, all these other things. The hope of this lawsuit is that they'll be able to establish a stronger standard for paratransit service based on the New York City human rights law. There's similar examples of this lawsuits, disability lawsuits based on New York City human rights law have been successful in, for example, homeless shelters. Homeless shelters in New York City have achieved a really good accessibility standard that's better than the ADA, and it's based on these lawsuits. But I also just want to say, New York State this past fall passed Proposition 1, which offers additional protections for a lot of categories of identity, gender, sexuality, but also disability. And when we talked to the folks at the NYCLU who were promoting Proposition 1, they told us that it was their hope that passing Proposition 1, which was passed successfully, would make it easier for them to win in lawsuits or settlements related to disability beyond the protections that federal things like the ADA, but also like Olmstead offer. So that was their hope. That hasn't really been tested yet. BCID and other independent living centers are part of a number of lawsuits related to transportation. And for us in New York City, the most sort of critical of that was a settlement that we got with the MTA about subway elevators. So that is a path forward. Lawsuits are also expensive in terms of resources and time. So we want to support people who are doing that. It's not a guarantee, but we do sort of look forward to seeing what the possibilities of Proposition 1 being passed in New York State are for people with disabilities.
Evan, that's a great point. All right, we have teased the study enough and not talked about it. And this is a study that the NFTA, the Niagara Frontier Transit Authority, did to, I guess, assess the cost and the practicality of this. Todd, you
So-
know the most about this.
Yeah.
Go ahead.
So-
Floor is yours.
So your tax dollars paid for this. I'm gonna preface what you're about to hear. Your tax dollars paid for this. As part of our advocacy to do paratransit expansion, we talked about nobody knows how much expansion in these two buffer areas would cost. Remember that whole thing I just talked about. So we said, great, why don't we do a study and figure out how much it costs? And a local Western New York state senator who is now a congressman put in the budget that year $750,000 to commission a study. The NFTA was charged with that $750,000 to estimate the cost of paratransit expansion in these two buffer zones and to propose a best practice model for paratransit. Now, I got to be honest, I am, even being a member of the stakeholder group that monitored the study's progress, I wasn't particularly pleased with all of the study results. And my primary negative is going to be phased like this. You know that whole part where they said they were supposed to recommend a model? Well, Nelson Nygaard, the contractor that won the bid to perform this study, put together a whole little kind of Avengers group of subject matter experts to answer this question about the model and about paratransit. And after working on it for about a year, their thing with the model is, well, we can't recommend a statewide model. Things fluctuate too fast and costs are too complicated. So it wouldn't be fair for us to recommend a statewide replicable model, right? And wouldn't it be nice if your college kids could write college papers like that? However, the thing that I like about the study and the thing that's going to advance our advocacy in the study is that they did do the cost analysis that was the basis of the study. Now, remember, we talked about those three pools. We call them the 3-mile buffer, 1.5 miles on either side, which is double what the federal minimum is, and the 6-mile buffer, right, which would be 4 times what the federal minimum is. Now, estimating that it would take a few years to get expansion up and running, the estimated cost differential for the 3-mile buffer is $5.5 million for one transit authority. For the 6-mile buffer, it's $11.5 million. Now, that's a lot of money. I'm not going to argue that that isn't a lot of money. But when you look at the totality of the New York State budget, right, those numbers start to become things that can be negotiable, ways that formulas can be modified to provide additional monies to authorities to do paratransit expansion. Because now we've got numbers we can rely on that a nationally recognized experts in public transportation say have some level of validity, right? So while I would have loved to see them, have an in-depth discussion of models, right? I do believe that every community has its own unique problems with being able to set up a model anyway. So being able to kind of base things on a cost estimate is a really important place to start. I tried to keep the conversation on that as brief as possible for you,
For
Blaze.
sure. Yeah. Now, why didn't they recommend the model?
Well, it was like I said, their recommendation was costs and situation fluctuate too widely for us to be able to fairly measure a model. But what they did do, I will admit, and anybody who wants to look at it can go to NFTA Metro Paratransit Study.com, right, and look at the documents yourself. They looked at NFTA as a model transit authority and said, okay, this is what they're dealing with current service. This is what best practices we would recommend for them in their environment, right? Including one of the things that one of our QA people mentioned, starting by shifting on time, right? Allowing paratransit buses to be scheduled at times that are earlier or later than the fixed bus that corresponds to that area would go. They did make some recommendations using NFTA as a model, but would not offer a statewide model to replicate because they thought that there were too many factors to be able to fairly do it. I know. Have I confused people yet? I probably have.
No, sorry, there was a little bit of a dead air or a little bit of dead air there because I'm going to put the link to the study into the chat, which I'm able to do as a panelist because that is one long site name to remember, and it is NFTA Metro Paratransit
Paratransit
Study.
Study, one word, .com.
Right. And again, for your convenience, I'm going to put it in the chat because that's just a lot to, that's just a lot to say. Now, again, I want to throw this out here to Evan, Cliff, and Stephanie. What stood out to you based on what Todd mentioned from the study, if anything?
Well, I'll just reiterate what Todd has been saying about, the costs, and being able to know your numbers really well. Um, I do think that is the barrier. I've been following in the Q&A, and a lot of folks have mentioned the problem of hiring drivers and not enough drivers. And this is a problem. We've heard this all over the states. It's a tough labor market for everybody right now, and so hiring drivers for paratransit is an issue in a lot of places. We've heard of staff who work for paratransit agencies doing jobs that are not theirs, like having drivers do eligibility, having dispatchers do scheduling, and things like that. We've heard of a shortage of drivers, of mechanics. In New York City, there's also a shortage of drivers, and there's also a shortage of trained drivers. So the training quality goes down when it's harder to find people. So, I think these are issues we have to overcome. It's not like we can magically increase paratransit expansion without having a plan to do so, but we think that people deserve it. And the reason that we want to know how much things cost is so we can advocate for it. Expansion of paratransit also has an economic benefit for a community that's not measured well, and it wasn't measured in this study. I think of, we went back to this study, we would have asked them, okay, so what is the benefit of all these additional people being in the workforce who are not in the workforce? What is the benefit of people being able to get to medical appointments on time so they don't end up in the ER? Things like that. So that's what we want to measure more, because I think we're not always factoring that in. But it
The
is.
cost savings analysis argument. Way to go, Evan.
I know Joe Rappaport, our director, keeps telling me we got to find like a smart grad student to do this. But this study was the really good step, because you can kind of say, okay, we've done this, we've studied it, there's a plan, there's numbers, let's go forward from here. That's, I would say, for New York City, we're trying to think of ways we could replicate that model of doing a study and then pushing for something, and finding more answers.
There's just a really interesting point brought up about drug testing in the Q&A, and the need to get rid of that. Does anyone have any thoughts on that? Cliff or Stephanie?
I'm sorry, thoughts on.
So there was just a point made in the Q&A on the need to get rid of drug testing for paratransit drivers, because of the person in the Q&A, and I'm sorry I didn't catch the name, said that essentially Uber and Lyft drivers, they don't need to be drug tested, therefore there's not an incentive to really increase the pool of drivers because of that.
So I can talk a little bit about this, because
Evan, I'll get to you. Cliff, go ahead.
Well, no, Evan might be better on this, because to me, I was like, what are you saying? We should have, we should allow drivers to drive who could be intoxicated or they're in the influence, and we're saying that that's okay. I guess I don't understand. I mean, I would think that in anything that involves the public, regardless of whether some part of the, like Uber or whatever, doesn't do the right thing, we should lower our standards to not to do the right thing like they do, when it should be the other way around. So maybe I'm missing something, so I'll turn it over.
And this isn't particularly surprising, because this is the same drug testing requirement that medical drivers need if you're transporting disabled people, being a Medicaid provider to get to a health appointment. My center runs a fee-for-service transportation service, and our drivers are treated the same way they treat school bus drivers, who are, also medically certified and drug tested. So I kind of agree with Cliff here, but I understand that could be a reason why there's a shortage of drivers. Now over to Evan.
Yeah, I think that last part is sort of the key here, is if there's a disparity between the pools of labor. So, the questioner mentioned the e-hail pool, and e-hail is what I talked about earlier, the paratransit on demand. So if you are just driving traditional Uber or Lyft, the random drug testing rules don't apply to you. But if you are doing those trips for paratransit, for e-hail, then it does apply to you. And that means that differential between, if you're a skilled and thoughtful and empathetic and well-trained driver, and you're thinking, where should I work? Should I put my labor in this pool that's providing services to just the general market population, or should I work in this pool of labor providing service to people with disabilities? Then you may be more likely to go to the place where there's less requirements, which creates a disparity for us. And this impacts users in a lot of ways. One of the issues that we're facing now with drivers, and we really support drivers, it's a difficult job, but we receive a lot of complaints about paratransit riders not being able to communicate in the same language with their driver, not being able to communicate in English with our driver. We don't want to penalize people for not speaking English, but we do want drivers to be supported to be able to communicate with the people that are in their vehicles, in case there's emergencies, in case there's direction needs, things like that. The fact that we keep getting more complaints about there not being drivers who can communicate in English with riders, we think is a reflection of the labor market and how, it's really hard to hire well-trained, skilled, well-supported drivers. And we want the workforce to be strong. So the issue of drug testing, yeah, we do want people to be drug-free, absolutely. But we also want to make sure that the workforce is as strong as it can be so people get the highest quality of service. We shouldn't have to think about this stuff, but we do because it impacts quality. So that's sort of my answer.
Stephanie, do you have any thoughts on this before we move on to the call to action part of our panel here?
I don't think she's with us anymore.
Okay, Stephanie did not come back.
No.
I know she was battling some power
Yes.
outages and stuff. And I see there are some people with hands raised. Well, Nicole, I may need your help with that piece of it. So,
Is it time to accept round robin from the audience?
we'll get to round robin in about 10 minutes
Okay.
or so. So the call to action part of this here, what and Cliff, I'm going to start with you first, and then go Evan, then Todd. What is one thing that people interested in expanding paratransit can do?
Well, I mean, first and foremost, just get involved with transportation issues in your local area. You have a transportation authority. One of the things we did in Troy, God, many years ago, was establish a very good transportation committee comprised of people in the community, people with disabilities, people working with people with disabilities. And we got to meet with our transit authority on a regular basis to discuss these issues with them and improve our services. So, I mean, that's always something you can do, and be involved with your local independent living center or whatever organization you're involved with that deals with disability, because there's really nothing you can be involved with regarding people with disabilities that doesn't involve transportation services. So, there's always a way to become involved. I do want everybody to understand a little history here, because history is my love, and I think it's very important to keep things in perspective that way. And I begin by letting you know that from the federal government point of view, they wanted accessibility back as far back as 1970, which is even before the Rehab Act, which is even before Section 504. There was an urban transportation law that talked about the transportation vehicle shall be accessible, and that they need to be accessible, that they should be accessible. I say it that way because I don't remember, I don't have the thing in here in front of me to remember exactly the wording, because the wording shall in any law means you will do it. It's very strong, where should or must is what I call fluff, and it may or may not happen, like the word may says. But the point is, from the point of view of the federal government, the point of view of government, accessibility is something we've wanted for a very long time. The issue regarding transportation and paratransit, specifically why we even have paratransit, isn't because of people with disabilities, and it isn't because of the federal government. Paratransit came about because the transit authority refused to make any of their services accessible, and they thought that there were only like 5 people with disabilities anyway, so therefore we'll just provide them with special buses and we'll save ourselves a lot of money by just doing that, and we don't have to then provide accessible transportation in our greater thing. So just know as you go forward that all of this is because transportation authorities themselves refuse to provide accessibility to their patrons with disabilities. And they even fought back even after laws were passed, which had some regulations changed because of court cases that they won that I don't have time to get into, that made it even more difficult to make their services accessible. So I say this in terms of going forward and fighting for it. Just know that the government isn't necessarily your enemy. If there's anybody's your enemy, it's the transit authority themselves. They're the ones that never wanted to provide this. And they're the ones that will tell you first and foremost, oh, we don't get any money for this. My response is, well, you would have got money for this if you agreed to make all your services accessible in the first place. It was your idea to provide paratransit because you didn't want to provide accessibility. So you shouldn't be screaming about that you don't have enough money for a service that you yourself are the ones that provided to people because you didn't want to address the real issue of providing accessibility. So just keep that in mind as you go forward. Be involved with your transit authority, be involved with whatever organization you are involved with to deal with transportation issues, and keep track on what is going on with this expansion bill for paratransit. Keep following it and keep fighting for it. Because as I said before, once we get a little victory, it makes it easier to get other victories.
For sure. And let's see, Evan, over to you. And of course, this is one of our top priorities here at the New York Association on independent living as well.
Yeah, I agree with everything Cliff said, especially, staying on top of your local transportation authority and connecting with your local independent living center. For these transportation authorities, they usually have regular meetings that you can testify at. Some of them have seats on their boards that people with disabilities can be part of. So staying on top of that's important. I'd also add on top of that, it's not just the authorities, it's every elected official in your region has people with disabilities in the region they represent. Some of them have large sites that many people with disabilities use. So it's something that you can talk about to every single elected official. Someone in the Q&A earlier talked about being in Putnam County, and not having transit service. I would say for people who are in that situation, there is still advocacy that you can do. The paratransit services that we're talking about, it's not just, for purely the benefit of people with disabilities. Everyone benefits. Older adults benefit. The economy benefits. People have jobs. People have better health outcomes. I'd also point out there are some parts of the state where different entities pay for forms of paratransit. So in the Central New York Authority, the Department of Aging does dedicate some funds for paratransit trips. And for people in the more rural areas, there may be other entities like that that offer some form of accessible transportation. There may be private entities that can provide that transportation. One thing we tell people to stay on top of is when development happens to make sure that people with disabilities are included in planning for that. So if, as I mentioned earlier, the state is giving, billions of dollars to Micron to build a microprocessor plant in upstate New York, but it's in an area where people with disabilities can't get to and can't be hired, then that's an issue you can be bringing up, not just to the Transportation Authority, but to every politician and elected official and agency who is involved in that. Stephanie Speaker's story too. I know in Buffalo, one of the issues was that a bus route that transported people to a state agency, the State Office for People with Developmental Disabilities, was canceled. This is a state agency. How are you supposed, for people with disabilities specifically? Though I know there's lots of other state agencies not for people with disabilities specifically that also are outside of paratransit and public transit range. So this is an issue you can bring up with those agencies. How are you going to be an effective institute of government if you're not able to get there if you have a disability? So it really involves work on all levels. It doesn't just impact people who are in the range of these transportation authorities. It impacts everyone, and we really have to be creative and work together to expand this. Also, for hire vehicles like Uber and Lyft in New York City, there are wheelchair accessible Uber and Lyfts. And that's something that we need to be pushing for other parts of the state as well.
Absolutely. Go ahead, Todd.
I want to piggyback on what they both said, because how can you follow that? Anyway, Basic Advocacy 101 for the lady in Putnam County. Make yourself known to your government about this issue. Everything that ever mattered to anyone if we look back in the history of that thing, we can point to one person that stood in a meeting or stood up and said, this is ridiculous, this is unfair. How do you expect this to happen or this not to happen if government doesn't help? Right? So it starts by basic advocacy because I love history as much as Cliff does. In my local community, back before we had paratransit, there was a decision that Western New York was going to make about whether or not they were going to do paratransit like they did in Albany, or whether or not they were going to do a completely accessible fixed route service, because back then there was a choice, right? Well, there was a group of consumers that wanted a completely accessible fixed route system because they saw paratransit as a mess. So that's what they advocated for. So from 1980 to when they passed the ADA in 90 and it became effective in 92, right? Our local authority wasn't doing paratransit like everybody else, but they were buying accessible vehicles. So we had a completely accessible or almost completely accessible fixed route system when the federal government came in and said, okay, now everybody's also going to do paratransit. And that started because of a small group of consumers who met with legislators who then, got the governor of the state of New York at the time kind of upset and made the authority commission a committee, which still meets to this day. So it starts by making your needs known to the people who write the checks. Right? I can't emphasize that enough.
You're absolutely right. Okay, now we'll open it up for questions and also to the lady in Putnam County. I believe it was Mary, and if I'm missing it, I apologize. There's a bunch of stuff in the Q&A that I'm trying to read here with my screen reader simultaneously.
Blaze Maria has her hand up, so if we can start with her.
Okay. Great. So what we're going to do here, before we get to Maria here, is there is, if you're not affiliated at all with Putnam Independent Living Services, then I would definitely reach out to them as well. They're at the Independent Living Center in Putnam County. So what we'll do and we'll get to as many people as we can. So for the raised hands, we're going to do this one at a time. And Maria, Nicole is going to unmute you, and you can ask away here. Or I think it's going to prompt. It's going to prompt you to lower, or I'm sorry, it's going to prompt you to unmute. Although if you didn't have a question, then all good. I think it just said that Maria lowered her hand.
Okay.
Nicole, who's next?
All right, let's go on to Jacqueline. I'm going to allow her to talk. Let's see here.
Okay.
Hi, everyone. My name is Jacqueline Anabi.
We've got you, Jacqueline.
How
thanks
are
for
you?
being here. You're doing well. Thanks for being here.
Thank you for having me. I am the town supervisor for the town of Putnam Valley, and I am on here because there are voices in Putnam County, and our residents do not have the assistance that they need. And to quote, and I think it was Todd who said this, to live a successful and full active life. So my goal, along with the residents in Putnam County, it's actually Putnam Valley and Phillipstown are the only two towns out of the 6 towns who do not have any type of transit services for ages 18 to 59. Everyone else would have a school bus or a senior bus or a veterans bus. There's nothing like that here in Putnam Valley because we just missed the 3/4 mark. And so my question earlier was, you said the 3/4 mark was a floor, not a ceiling. And I'm trying to find that. So when I go to the legislators, because I'm asking this to put them on the agenda, that they expand that based on the fact that it is a minimum and not a maximum number, and they could very easily expand this. They told us that was the maximum.
Well, that's obviously incorrect. And you can look at Title II of the Americans with Disabilities Act. That's where that issue would be addressed. And as I said, keep in mind that paratransit wouldn't have even been here if it wasn't for the transit authorities themselves saying that this is a service that they wanted to provide. So always remember that and always let them know that when they refuse to provide a service that you're asking for.
Excellent. I plan on taking to the legislator, and I did ask them to put us on the agenda. So once that happens, I'm hoping the residents that have reached out to me do join me in this loud voice. So thank you very much for this. I learned a lot from you all.
The thing that I always say when we talk about the standards for paratransit, it's the minimum we must do, not the maximum they will allow. Anybody who tells you that is actually making an argument about how expensive it is, right? So, make that point out and then kind of raise that whole thing about, well, how expensive actually is it? Right? Force them to kind of, either prove the argument or not.
Okay.
Fantastic. Jacqueline, thank you so much. Nicole, who's next?
All right, I'm gonna go to Darlene and allowing her to talk now. Are you there, Darlene?
Darlene, you probably got a pop-up on your screen that asked you to unmute. So
it says
if
she's
you
unmuted.
Yeah, it does.
Okay.
Can you hear me okay?
We got you now, Darlene.
We got you,
Yep.
Darlene.
Yeah, sorry, I had to change my headphones. I apologize.
All good.
I
Good
wanted,
to see you. Thanks for being here.
yeah, you also. I wanted to mention about transit and how transit can be beneficial. I've been having trouble with Access VR getting to and from my services that Access VR is trying to get from. So school, medical appointments, work, shopping are all different places that are having trouble with accessing services because it's not really good to be biking, especially here because it's freezing outside, no matter what part of New York or what part of the country you're in. As Florida is still getting snow. It would be a lot easier if we had paratransit in certain areas, but where I live in parts of Saratoga County, we do not have a fixed route bus service, so we only have the flex bus, which has gotten me stranded and multiple other people stranded. I am well known to the community, so I was able to get help a few times where other people have not, and they've ended up having to walk many miles, and some people had to walk and then ended up getting put in the hospital because of their situation afterwards. There's not been many drivers, so we've been getting stranded because of that. The drivers have been saying that the transit company have not been treating them properly and fairly, so they don't like their job and they've been quitting because of that. I want to advocate for those of us with disabilities, and because of that, I know we're not trying to get into politics here, but as far as persons with disabilities, I'm also going to be running for mayor of my local city, because people with disabilities can also have a disability no matter what kind of disability, including developmental disabilities, and still become mayor.
Well, congrats, because that's great that you said that, Darlene, because we do need more candidates with disabilities, and I know because we live in the same area here how much change you've been trying to make and how hard you've been working on this stuff and how unfortunately unsuccessful you've been because people really haven't been listening to you. So I think it's great that you're going to throw your hat in the ring for mayor.
Thank you. I mean, we also have Global Foundries up here in Malta, up in the middle of Saratoga County, but you can't get to work. I mean, they have security guard jobs, which I mean, I'm more than qualified for, but I cannot get there because I don't have a way to get there. There's no transit up there, and there's no way to get up there. So it's really difficult. And I would just like to get changes, and there's many people around here in my area that need change as far as getting around and transportation, and that's one thing that I would like to make a change later tonight. Please pray for me if you don't mind. I'm going and being a strong person and speaking up against the town I've never been to, in the town of Saratoga, because their planning board wants to side with this other property owner that
Yeah.
also has a case with the Attorney General's office, and it's all about money. They don't want to make it safe for the tenants that live in that mobile home park.
For
sure.
So
All
I'm
right,
gonna go
Cliff
against
is
that.
unmuted here, Darlene, so I'm going to let him weigh in.
Well, Darlene, first of all, I want to say it's good to see you here, and as always, it's always glad that I'm glad that you've been so involved in doing all the things you've been doing, and to speak specifically to what you said about your involvement, that also answers part of the question that has been asked before about how to become involved. Another way to become involved is to get involved with your legislature, run for office, or run to be on the board of your transit authority. Like our executive director, Ms. Denise Figueroa, has been chair of the Capital District Transit Authority's board of directors, and she's running for chair of the National Organization for Transportation actually right now, and hopefully she'll win. But this is just another example of, to go further, when people said about how do we get involved, there are many ways to get involved, and these are just some of the ways, as Darlene also mentioned. And good for you, Darlene. And also, Darlene, we have been hearing you. I know that place said you haven't been heard because things are so difficult, but we're hearing you. You know that I hear you, and I make sure that I point out what you're doing in my reports whenever I can. So good for you for all that you do.
Right. Well, what I meant by that was just what I meant by that, and thank you, Darlene. We're going to move on to other people.
Well,
Go ahead, Todd.
One other quick comment for Darlene before she goes.
Yeah.
Right. In listening to your story, one of the things I think you might be ready for now is to go to state representatives that deal with transportation and start talking about that deficit. I think the more that the transportation committee chairs start to hear this story, the rural communities and the suburban communities that don't have transit authorities are kind of the people that get thought about last. And I think you're in a unique position to kind of leverage yourself to advocate for that a little bit more. So I know you've got the strength to do it. I know you've got the experience to do it. Let's encourage as many people as possible to tell your story about that. Get that in the hands of your legislator and send a copy over to Senator Cooney and Assemblyman Manganelli?
Magnarelli.
Magnarelli, right? So that they know that these are the stories that you're talking about. Because a little 10-second vignette for you. I was appointed at one point to the Transportation Network Company's task force on disability. We were supposed to recommend how upstate Uber and Lyft services were due to be accessible, right? And they had regional hearings from the public about the importance of accessibility for Uber and Lyft. The problem is most of the comments we got in the local communities when they got there to do the hearings weren't about Uber and Lyft. Guess what they were about? No kidding, paratransit. So there is a lot to be said about making your voice louder. So I really want to encourage you to go and do that.
Thank you so much. And I just want to end by saying thank you to all of you guys. Evan, I'm going to send you an email because I have your email. If you could just send it out to all of the presenters, that would be great. Thank you.
Yes. Thanks, Darlene.
Yeah. I'm going to, everyone's going to get a copy of the the recording and such. All right, Darlene, thank you very much. Great points as always. I think we have a couple of hands up
We have
here, Nicole.
2 more. We're going to go with Mary Cronin next.
All right, Mary, I believe we have referenced you a little bit here, in some of the Putnam County conversation here. So go ahead when you are unmuted. There we go. I think we've got you.
I still have a mute marker
It's
for her.
still-
on my screen.
Yeah.
Okay.
The button to unmute her is not working.
All right, we'll come back.
We'll go to-
Mary, we'll come back to you. Yeah.
Let's go to Gail and I'll see what's going on with Mary. Hold on.
All right.
Here's Gail.
It's like we're doing a call-in talk show. You hit the button for me, and it's like I'm Frasier. We're like Frasier. We're listening.
Yeah.
Paratransit Radio, you're on the air.
Yeah. Are
And
you
I
waiting? Odds
Can't
are,
get
yes,
them
you
on
are.
the air.
All right. Well, we are.
It's not working for Gail either.
Okay. Try lowering Darlene's hand and muting her if maybe that's.
Okay, Darlene is gone. I already took her off as that.
Well, she's still here, but right.
I mean, she's still. I mean,
right.
yeah, she's her hands down.
It looks like Gail is
Down.
no.
Okay. Now let's see. Try that. Nope. All right, let's go with next person. You don't have a name.
right.
You're calling in.
But I know who it is. The number is familiar to me. Go ahead, Andrew.
Oh, thank you.
Thanks, Todd.
Good afternoon, everyone. This is Andrew. Hi, Todd. Nice to hear everybody.
Hey, Andrew. We've got you loud and clear. Thanks for being here.
Okay, great. There's a great conversation here about the paratransit, and Todd knows I'm a very strong advocate with transportation. And one of the things I would like to speak up about is for all of us as true advocates and it was brought up again, I want to bring it up again, is if there's something good or bad going on with the transit organization or anything to do with transportation, we as advocates and riders need to let them know. I said, if we all talk between ourselves, which I hear all the time, I'm on a paratransit or that, and you don't call customer service and let them know, the company might know what's happening, but if they're not getting no concerns, complaints, or accommodations, in their eyes, everything is perfect. I said, that's a big thing I really push with riders here, locally here in the Buffalo area, I said, that I talk to is, if they don't speak up to the company has no idea that there's an issue or a concern. So I just want to bring that up. So as us as true advocates is, we can't be afraid or concerned to pick up the phone, to send an email to when there's an issue or a concern, because that's how things get solved and worked on.
Andrew, you could not have hit the point better. You are 1000% right on that. And you're right that while it's good for us in community to be putting our feelings out there, we can't expect people who we need to make change to make that change if we're not telling them about it. You are absolutely right. Thanks for that point. Any other hands up, Nicole?
Nope, no more hands.
Okay, well here, let's try with
I could try with Gail. Gail, do you still wanna I can allow you. Oh, Mary. Oh, let's see, Mary.
let's see.
Hello, can you hear me?
There we go.
Yes, who do we have?
Yes, hi.
Mary!
Hi, it's Mary Cronin from Putnam Valley. I'm sorry, I did take a call a few minutes ago. I didn't realize that you had unmuted me, but I just
All
wanted
good.
to say, thank you. I just wanted to say thank you. So myself and there's another lady who's not on right now. Her name is Dana Barty. and Kathy Curran, who's listening on her phone, and a few other people in Putnam Valley and Lake Peekskill, which is part of Putnam Valley. We have reached out to William Goldman. He is our county legislator. Kathy had talked to Vinny Tamaga, I think his name. He used to be director of transportation for Putnam County, but then he moved down to Florida sometime last year. And I believe that Dana also talked to Mr. Goldman, and has been in constant contact with Jackie and Abby, and I'm just absolutely thrilled that she was able to participate today and that she is working on our behalf. And I just wanted to say that thank you for doing this. It raises a lot of good points. It brings a lot of awareness that I wasn't aware of about how to, be able to become an advocate. Like I wanted to do it, but I wasn't quite sure, who do we talk to? Who do we, speak to? Who are the people? So, definitely government leaders are really helpful. What we're interested in, we want to make sure that our government officials understand it's not that we're just looking for something like regular bus stopping at different routes along the way to wherever, but a door-to-door type of thing. We have people in our town who are mobily challenged, I guess is a good word for it. They wouldn't be able to go down to a bus stop. Putnam Valley is very windy, very woodsy, and it's not like very easy to get around.
Sure. Yep.
And that's what we're looking for. Like I know Westchester has door to door. We're looking for something like that. Is that something that's harder to get approval for with legislators? Like I'm not quite sure. I looked at the Putnam County website and it kind of said we do offer paratransit, but it goes along the same lines as the regular bus route. And I was like, well, that's not really helpful in my town's case.
Well, fortunately or unfortunately, that's the law. In other words, the law says that paratransit must follow the fixed route. The good and bad, the good is that if you at least get others who need fixed route to get involved, because that goes beyond people with disabilities, right? Now we're talking about other people in your community. I would suggest get them involved if indeed transportation is that important. Because once you get fixed route going, then it automatically kicks in paratransit. Does that make sense?
I mean, yeah. So what you're saying is that we need to get fixed route for just regular bus service in our town, and that will automatically kick in paratransit because
Well,
that's what it.
the regular bus
Mhm.
is what we call the fixed route. All right, so you
Oh, I
you need
see.
to have fixed route service before paratransit, because if you had, from their eyes, I'm saying it, okay? If you had
Okay,
paratransit without fixed route, there'd be like special services. God forbid we should have that. But if you have, but if you have fixed route, then
right,
remember I said from the beginning, it was the transit authorities who were against making everything accessible. So part of the
right,
deal was, well, okay, then if your fixed route is accessible, you didn't want to make that accessible, originally, then you need to provide paratransit. So
right.
that's why you don't have paratransit, because you don't have fixed route. So you'd have to have without getting fixed route there, you're not going to get paratransit there.
Right. We did have a fixed route for a limited time. It was in the morning and afternoon for commuting to the Peekskill train station
Sure.
from our
Yeah.
town, but because they were only the
Y-
last run in Navy was
Yeah,
6 o'clock and people
Right.
couldn't make it from New York City, they said, oh, no one's taking the bus. Well, of course no
exactly.
one's
Right.
taking it. You're not making it, like people can't get to the bus on time from the train station because you're not, so
Exactly.
they
Right.
ended it. So
Right. So what I'm saying to you,
right,
that's really where your fight is. Don't
right,
think
right,
of it
right.
as fighting for paratransit. Think of it as fighting for fixed route. Then
Okay.
paratransit will automatically come with it.
Okay.
Well, yeah,
And
And
when,
you're right. And I'm sorry, we have to leave it there because,
okay, thank you.
just because of timing,
Got it.
because, for our ASL and our interpreters and capture, if you have
Thank
any
you.
questions that we did not get to, Mary, thank you very much. If you have any questions that we did not get to, if you reply to the reminder email for the webinar that you got, those will come to me, and I will make sure that I share them with Todd, Evan, Cliff, and Stephanie. So thank you all so much. This was a really good conversation. The hour and a half flew, and I will send out the recording and survey to you tomorrow. So with that, have a great rest of the day, and thanks everyone for all of your help with everything, Nicole and our interpreters and captioner, and to all of our panelists as well. Thank you all so much.
Thank you.
Thank you.
Thank you,
My
everyone.
pleasure. Thank you.